Great. Okay. So I did want to point out up here, there is a QR code. I don't know if you guys can scan that code without the actual slide, but it's also on our website. We have a free AI guidebook. I do want to mention for our clients only, we have a much more in-depth step-by-step guide on how to implement AI, and we're going to be rolling that out to all of our clients very soon. So this one here that's free is a little bit more generic, but I am going to be talking about that step-by-step on this call today. And then in addition, for our clients, we have the actual guidebook as well. That's a little bit more detailed, because the reason it's just for our clients is because it's specific to our business process and how we work with our clients. For those of you that I haven't met, I'm Amber. I've been in senior living for about 20 years. So I worked for a provider for 9 years and then started Parasol Alliance 5 years ago. We are provider owned. Currently, our main business is full service IT support in 10 different states right now. And we also do a lot of technology, strategic planning, consulting, security, things like that. And then also I don't think we have a slide for this, but we also have a podcast called Raising Tech. If you guys haven't heard of it, we have done a bunch of AI episodes and webinars as well that are available. And these are all free resources for you, along with the AI guidebook. If you want to get more into any of these topics, like we did a specific webinar in sales and marketing AI, which we also put on our, I think our YouTube page and our podcast page as well. So you guys can check that out, and all that's available on our website. Okay. The first question I like to ask is if anybody can put in the chat, I've got a question up here on the screen, but I'm gonna ask another question. So first of all, when you hear the word AI, which is like a buzzword, and we're going to talk about what it actually is, but what does it mean to you? And then also, is there anything you're hoping to learn today specifically about AI? And if you guys can just put something in the chat really quick, I'd like to just check that out. People can type in the chat, right?
Yes, they can.
Okay. I don't see anything yet. So all right, cool. Streamlining busy work. That's a great one. Resident engagement piece, that we're going to talk about both of those. Or if you just are here to learn and don't really have any specific questions, that's fine too. But I was just curious to hear what you guys came into looking for. Okay, HR assistance in doing research and tasks. Okay, just here to learn, see what's out there. Okay, we'll see if we get any more. But we should touch on all of those topics. So primarily the outline of the webinar today is essentially, what is AI in general? Like, what does it mean? Where did it come from out in the world? Then we're going to talk about the specific use cases for senior living. And we've developed a 5 pillars of AI approach. And we'll go into depth about those and what they mean and how to implement them. We did write, so the QR code on the first page was for an AI guidebook. And then we also published, I think it was over a year ago now, an AI white paper in addition, where we interviewed, I think, 18 different vendors in the space and published their thoughts on AI. So we're going to cover that briefly. And then we're going to talk about governance as well. So I know that AI is the newest buzzword. I mean, you can't go to a conference today without hearing about it. If you guys remember back in, 15, 20 years ago, the big buzzword was the cloud. Everybody wanted the cloud. Nobody knew what the cloud was. People probably still don't know what the cloud is, but, I feel like AI is the new, cloud buzzword. And, people are talking about it, not really sure what it is. But it's actually not new. So it's been around since the 1940s. And I thought this was really interesting that the world's first AI conference was actually in the 1950s. I think the reason AI has become so prominent now is really with ChatGPT and it being accessible to people. But I thought that was interesting to learn that it's actually been around for quite a long time. So what actually is AI? So there are 4 categories of AI. So there's reactive. So that's just being able to react what's happening. They don't really necessarily learn or remember anything from the past. So just being able to like send an alert if something happens. Limited memory. So they remember a little bit to be able to make better decisions in the future. Theory of mind still being worked on. So if you guys, I don't know if you guys saw, this is like a few months ago now, that those Tesla robots, those were actually operated on the back end by a person. They weren't full AI, but those were meant to just like kind of envision the future of what this could look like in the future. This would be more of like an AI companion robot type of thing that understands emotions and thoughts. And then self-aware. So this is the one that scares everybody. And I think I've got this picture here. This is just a graphic I saw a while ago that basically the guy standing by ready to unplug the AI if it becomes too self-aware. So we aren't there yet, but I think that is one of the fears people have of AI. So as far as what AI is, I mean, those are basically the 4 types. It's machine learning, and so it's smart learning, and then there's various types of that learning, either from just being reactive or a little, the limited memory, which is where we're at now, like a chat GPT. Everyday examples. So, the thing about AI is everybody's using it, and you may not even know you're using it. Everyday examples of how you might be using it would be Siri or Alexa. I have an Android phone, so I have like Google Gemini now on my phone. You guys all have probably experienced, if you go to do a web search, now you're getting AI results. Even Netflix recommendations, like some of the algorithms in your IT tools, it's being built into things like your spam filters. And then I think this has been around for a while now, is chatbots that is can be put on your website to answer questions, both for senior living communities and then also just out in the world in general as well. I like to just bring this up because one thing that I don't think a lot of people know is that there is a huge environmental impact of AI, and that's from the data servers, the data farms, and the huge amount of power that it takes to make those things work and function. If you actually, I heard a stat that I think it's on here, when you're saying please and thank you to your Alexa or, whoever, it's actually racking up tens of millions of dollars, because every time you do that, it processes that on the server farm. So, I mean, it is a big environmental impact, and I'm not sure yet how we're going to deal with this in the future, but it's something I don't think a lot of people realize is the environmental impact of using AI. Okay, that's kind of like the generic AI piece, and now we're going to really spend most of the time digging into the senior living aspect. So, we started hearing about AI probably like 2 years ago. And what was happening is we just have clients coming to us and saying, we want AI, like I was saying in the example earlier about the cloud. But again, like not really knowing necessarily what it is or how to use it. And so that's why we built all of these resources, because with any other new technology, you don't want to just go out and get it just because you think somebody else has it, or you met a vendor at a conference, or you're hearing about it. But at the same time, you want to be educated on what it is, because if you have board members coming to you or residents coming to you, or, maybe your CEO is like, we got to get AI because everybody else is doing it. You want to be thoughtful about how you're implementing it. You want to make sure you understand the business case. You want to understand what's out there. And, like any other technology, you want to make sure that it's actually really useful for you. And that's what hopefully you'll be able to walk away with today. One thing I do want to say is we talk to a lot of communities who think that everybody else has AI and everybody's doing something they're not. And we have not seen that that's the case. I think to use it, I mean, there's a couple things that you can use really quickly and easily that we'll talk about today, like ChatGPT, but to get into the true power of AI, like data querying and things like that, it's pretty advanced, and most communities are not ready for that. And again, we'll talk about that, but I just want to reassure you that if you are not using AI today, you're really not far behind anybody else. Okay, so these are the 5 pillars of AI that we have created for Parasol, or the way we've categorized it. And I've run these 5 pillars by a couple of AI experts in in AI in general, just IT AI experts, and they've agreed with these categories. So we feel good about that. So we're going to spend some time going through these. And again, feel free to comment. And then also, if anybody is using any of these and has examples to share, I'd love to see it in the chat. And I'll stop and ask that question as we go through these. But I think some of this information is best digested by seeing what is actually being used and what's realistic. Okay, so first one we're going to talk about is meeting note takers. So this is like a super easy one to get into AI. And, going back to some of the comments about people looking for just time saving or how to eliminate busy work, this can be a great like first step into AI. So I'm sure most people on this call has probably experienced that. Either you're using it or you've been in another meeting where someone's using it. A couple of meetings I've been on, I'm like, there's more note takers in this meeting than people because like everyone's having their AI note taker join. So not sure if you guys have experienced that. So as far as like use cases, I think everybody knows it just will summarize things, action items. It will generate the emails and the write-ups for you. So it has, some time saving tips and things like that. It's super easy to implement. And then it is nice that if you guys have seen it, it does give you that action item summary. Things to be aware of, like some of the caution is it in some of the note takers, not all of them, but like the Zoom one, for example, it does email everybody after the meeting a transcription of your meeting. And so I know I've definitely been on meetings where you start talking about something else not related to the meeting. And then you're like, oops, it's taking notes on everything we're saying. It doesn't do it word for word or anything. But you just want to always make sure that you're aware if that's on. And if it does do that auto note thing that, it's just something you have to think about extra that maybe you weren't thinking about before. Like I was on a call with a coworker and we were talking about something work related. And then we started talking about taking naps and then it got caught in the AI note taker. We're like, oh no, not the naps. Now it's recorded. I think the note taker future possibilities are powerful when you start thinking about the way that some of these note takers, and we'll get into robot process automation, it's the last pillar, but combining it with that, where we can start to transcribe things instead of typing them. For example, clinical notes, charting, things like that. But we're not quite there yet because most of them don't really integrate with the main systems that we're using in senior living. Something else to be aware of is you do want to make sure that you're using one that's HIPAA compliant, even if, kind of going back to one of the cautions is like, even if you have like a policy that you aren't allowed to talk about PHI on a meeting with a note taker on, you might forget and it comes up, like you're having a side conversation or something before the meeting starts. So some of the ones that have the HIPAA compliant Zoom for healthcare, you have to sign a BAA. Microsoft Teams and Copilot, and then Plod. And then some of these down here at the bottom, they don't they won't do a BAA. And so if PHR were to be in them, it wouldn't necessarily be protected or covered. And then over here on the right side are some examples of some medical notes, note takers that you could look into. So some things to think about before you start using a note taker, or if you're already using one, then, something to circle back to and check these off. So, do you have a platform? Are you using Zoom? Are you using Teams? Do you have, there's a bunch of others. Is there one that everybody's using? Have you set it up so that, how is it being administered? So, is it set up that it's on every single meeting and people can't turn that off? Are you leaving it up to the choice of the people in the meeting? So just make sure you have good administrative policies around that. And that's the usage policy piece. Is your staff comfortable with using it? Who's gonna manage the note distribution? And then how could it be beneficial? So again, you don't want to go out and just like implement this if it's not actually beneficial to you. So I know it's like super easy and it's out there and you just click a button to make it work, but it's something to think about. Does this actually help you in any way? And how does it help you? So again, for our clients, this is all kind of in our guidebook that we're going to help them work through with these questions based on the systems that they have.
Amber, I'll ask you a question here.
Yeah.
Just for familiarity, LeadingAge Missouri is using AI transcription. We use something called Meet Geek.
Okay.
I didn't see that in any of your slides. Is that we did not have to sign a BAA, so I would assume it is not protected software. But one thing that I will tell you is you do have to be careful when using them for transcription of what you noted on there, the side conversations.
Mhm.
If you are having a powwow during a break, you know, the AI tool does not know that you're having a break.
Yep.
And if someone's talking about something, it can be lifted and recorded because they are very sensitive. So anyone looking to do this, which I recommend, it's made transcription for our board meetings and other meetings very easy. But those are some of the bumps that we have found along the way of everything that it does record and who it sends it to and what other pieces it can pick up. So I would just always be aware when starting that software that it is capturing everything that is said. So just note that.
Yeah. 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 I've had a couple couple times where I'm like, oh wait, this is recording. Especially if you're on a call before everybody else joins, you're just chit-chatting. But anybody else have any other feedback or anything you want to add on the note takers? Please go ahead and put it in the chat if you'd like to comment on that. And then I see you put a question to our large EMR companies considering expanding for medical record documentation. I've been asking this question too. And we'll talk about this a little more when we get to RPA, but I don't believe from the interviews we did a couple of years ago, or maybe a year and a half ago. So we did talk to Yardi and PCC. I don't think we talked to Matrix, and I don't know if any of them are doing it yet. But I think it's a legit question, and I think it's something that they should do to be relevant and to improve process workflow. But the other option is to use an RPA, which again, I'll get to that a little bit later. Okay, I don't see any other comments on the note-taking section. Okay, this next one is again another very accessible way to use AI and probably the way people are most interacting with AI. So LLM is like a broad term for something like a ChatGPT, and there's other tools in ChatGPT. People kind of use that like the word Kleenex. It's just kind of a common word now to refer to these LLM tools. So some of the other ones out there would be OpenAI is at ChatGPT. There's a Chinese one, DeepSeek, that is not HIPAA compliant, by the way, so don't use that one. Oh yeah, you've got some of these over here, Amanda. So Microsoft Azure, you have to you can do that with a BAA, Copilot. So these are, has everybody used these? Can people raise their hand? Can I see that? I feel like most people on the call have probably done this. Okay, I see some hands going up. Yeah, so I have to tell you guys, like when we first started doing AI presentations a couple months ago, like my first one, I was like, I don't use it. I'm scared of it. Like, I'm one of the people that like, I didn't really understand it. I hadn't personally used it in my very first presentation. And luckily the first presentation I did back in March was with 2 other people who were super knowledgeable. Since then I have started to use some of these tools, and it is amazing how accurate they can be. So at Parasol, we use it pretty heavily. So we create an Amber GPT, which what we do is we take all of the, like this webinar, any podcasts I've done, anything that's public facing, and I'll talk about that a little bit. We've fed it into Amber GPT, so it knows how I talk, and sometimes it's too cheerful. I have to tell it to be a little less excited about things, but it does really like mimic your tone and learns your language. And then we also have a Parasol GPT and a couple of others, which is pretty cool. So some of the use cases for this, you can ask it questions, you can ask it to figure out formulas for you. I mean, I personally use it for like generating content, which a lot of people are doing. And, you got to be cautious because sometimes it seems like very AI generated. So you want to like modify it a little bit so it's not full AI, but it has some of your original voice and things like that. Some of the business case uses is policies. I had ChatGPT draft an RFP letter for me for something for Parasol, not for a client. And it was through Parasol GPT, so it knew all about our business and when we were started and stuff like that. So it wrote the whole RFP like perfectly for me. There's a lot you can do with marketing, and again, we did a whole other webinar on that. So I mean, it's pretty amazing what it can do and how much time it can save you. So when you're looking for time saving, this is a huge one. However, there's definitely things to think about. So everything in these tools, unless you have a private tool, is public information. So you don't want to put anything in there that you don't want anybody else to know about. Because it's learning and it can, and then that information searchable. So when I was saying where you have a Parasol GPT, we only put stuff in there that's already available, like this webinar, for example. But if we have like internal confidential documents, we wouldn't put it in there. Something that applies to all of AI, not just this one, but because this one is the most accessible, is that AI is not always correct. So it doesn't know everything. I mean, it'll include information that's not accurate. So you have to be aware that it's not, it's not always 100% accurate or factual. And I think this is somewhere else in our presentation, but also neither are people and neither is other sources of information. So I don't think it's necessarily a con of AI, but like sometimes people think because it's AI or ChatGPT that it's all 100% factual. And then again, here's just the resources to some of the tools out there that you could use. So how do you know if this is something that would be useful to you? So do you have tasks that you want to speed up or automate? Definitely you want to have a policy for this because a lot of people aren't aware, or they, don't realize that all of this is public. And so again, if you're going to put anything in that's confidential or has HIPAA information, you want to make sure you have a policy for that and you're using private tools. Something that occurred to me recently, we have a vendor who wanted to start putting some of our data. They're like, we're going to put it in ChatGPT and help use it for your business. And I was like, please don't do that, because it was like financial data. And I was like, do you have a private server? So it's one thing is to start asking your vendors too, if they're using AI to support you, how are they using your AI data? So like we use Slack at Parasol, and Slack is rolling out a new AI tool as well. And so that was the first thing we asked, is like, is there something in the contract that protects our data being private? So that's all things to think about. Yeah, and make sure that somebody is responsible for reviewing or editing that content. So there's certain tells in the AI, like, so it'll put like if you guys have ever used it, it'll put like a long dash in ChatGPT. And if you see that, you know that that's written by ChatGPT, not a person. So you can always like take those out to make it look less like AI. And then it adds like icons and things like that too.
So Amber, I have a question as we're discussing this in private and public, because as you know, with our marketing term, LeadingAge Missouri, as does everyone probably with their marketing firm, use an AI tool. They're using it for data collection, and they're using it to really hone in on what people are trying to contact their business for, to highlight the most popular subject. Most are doing this, and you're getting that through your back end website and things like that. But I am going to say that I agree with you on making sure that that information is private. You're not wanting everything that AI can grab to put into your marketing tools in order to assure. So just know, I mean, there's not two different forms of AI, but there is definitely private AI and public AI.
Yep. Yeah.
And
And unless it's built for you and you've signed all
right.
the agreements, it's not private. So don't assume it's private unless you've gone through that process.
And I agree with you. And I think that's what everyone should know when they're considering it, is it definitely, you need to know that what you're putting out, maybe not what you're gathering, but what you're putting out is private, especially if it's only something internal.
Yeah.
So just really wanted to put that out there.
Okay. Any other comments in the chat about those tools? Okay. Next one, the third pillar is AI in the business systems you already have. So again, we have some information at the end of the presentation about what we've heard from some of the vendors out there, but I think somebody mentioned Resident Engagement. I know Touchdown, Cubigo, Icon, they're all building AI into their platforms. I think we're starting to see, I've heard HRIS systems are building AI into their platforms. I'm doing a couple of client RFPs right now, and that's one of the questions we're actually asking the vendors now is, I helped a client do a document management software, and that was one of the things we asked is like, is AI built in? Is it learning AI? Just some things to be aware of is that you may need to upgrade your system to turn it on. and it might be on without you even knowing too. But, you know, kind of going back to what I was commenting earlier, make sure you understand how those vendors are using the AI and that it is private and protected. So, and I see spell check changed it from EHR to her, which it always does. So yeah, I think we're still like, I think the question asked earlier is like, how are some of these vendors rolling it out? I don't know yet. I think it's something we need to ask some of them about. But it's definitely in some of these other tools we know about, like Amba, Safely You, some of the resident engagement apps have it in there. So I know, like, I've seen Icon, LifeLoop, and I think in Cubigo, they have built like this resident happiness indicators, and they're using AI for data analytics and things like that. So yeah, this is something you're interested in. I mean, I think the first step is to ask all the vendors, what are you doing to put AI in our tools, and is it protected? Is there anything we need to do differently? Do we need to upgrade? Are there different features we have to turn on? Does it save us any time? If there's new AI features, is there anything we could do differently with our processes that we didn't have to do in the past because now AI is doing that for us? Any comments in the chat about business systems?
I see a question here from Sue Jackson. Sorry to call you out there, Sue, but I know Sue. And she's using Copilot and Chat GPT, but it's the tools that she's having a hard time implementing. So when you're talking to your vendor, is this something, Amber, that you would be feeding to your vendor of, I'm looking for this, what can I upgrade to get this? Or do you really want to feed that back from your vendors and say, this is what we can do easily and let's work on this process? As your state of implementation, do you lead more on the vendor, your service provider, on what they're bringing in? Or do you think companies should take a proactive approach of what they could do easier and then source backwards? What's kind of your thought on that?
Well, I mean, the second approach I think is ideal, but most vendors, you know, they're not going to necessarily implement every idea you bring them. So I think it depends on the vendor and the situation and how big of a vendor that is. So like if, you know, if you're on Kronos, for example, for HR, that's, you know, they're not just in senior living, they're a huge system, you know, huge system. They're all over the place. You know, but the thing is, vendors at that size are already thinking about this because they know that they need it for themselves as well. So I think it's both. I think it's good to have like the conversation to bring up what you're looking for, and you could do that through an optimization project. But I think it's also good just to ask the vendors, what are you planning to roll out? Because they might even be telling you that they're rolling out AI in their systems.
That's a good point. Thank you.
Okay, this next pillar, I'm going to talk about the fourth one. This is the one that I am personally the most excited about. I think this one is really cool. And I also think this is the most critical for senior living communities to understand, because this is really where AI can have a really, really powerful impact. And what this is the ability to build private AI for analytics and data querying. So I know for a long time, this industry has been really lacking when it comes to data. So, you know, I think a couple of years ago, we started to see a big increase in like KPI dashboard tools. So Profix, CareWorks, Seniorlytics, comms, those are some of the ones that are out there. And even people are using Power BI just to build their own analytics tools. What this private AI analytics does is it really takes that to the next level. And I personally think that communities should skip that static dashboard creation and go straight to this tool now that this is available. So, and some of those systems I just mentioned, they're building AI into their tools, but the difference would be is like a standard like dashboard would be pulling data from all of your different systems. So be pulling data fields. So financial information, you know, resident information, HR information, EMR information, and it's pulling it's talking to all your different systems, your HR, your finance, your EMR, and it's pulling all those field, you know, by field into a dashboard, and it's displaying that information together. So it's giving you that KPI dashboard, sort of static information, like it's pulling it from your systems. It's not really doing anything with your data. It's just displaying it for you. And that's hugely beneficial and useful. And it's a lot more than a lot of communities have. But what you can really do is you can take it to the next level. So if you add AI on top of it, so the AI tools can do not only what I just said with pulling the data, but it can now query your data for you. So you could, if you're using, and it's just like you talk to your phone and you ask it questions on Google and it gives you an AI answer. So you could, if you have it connected to your data personally, it's private, you could ask it questions like, you know, the nurse is coming in for their shift and they say, give me this 24-hour shift report. It gives you a generative AI answer. Or identify the changes in medical conditions over the last 30 days and correlate those to medication changes. Or you could use it, you know, for your financial data and say, tell me my top costs in the last 6 months and categorize them and note any changes. So being able to add that querying on top of just like the static information is just where I think this is going to have a huge impact and be hugely beneficial. So I think if you're exploring like an analytics tool, I would look at this and make sure that this is included in any tools you're looking at. Now, that being said, this is one of the most difficult and long-term things to implement because it involves your actual data. So it's not an out-of-the-box solution like a ChatGPT. So, and again, this is something, so I don't know if we had a slide in here. This is something that's, you know, with our clients, we have a whole technology roadmap process. And so this is like built into the roadmap. So the first thing you need to do is you need to make sure you have those right systems. If you're planning to change into your systems, like if you are changing your EMR, your HR, whatever, you want to do that first. So you don't want to get into this until you've done that, even the dashboards. Then after you've changed your systems, you need to optimize those systems. You need to make sure that the data is in them because you can't put this on top of a system where you're doing all your budgeting in spreadsheets. Like it's not going to read your spreadsheets. I mean, some of them kind of can, but like, you know, you want to make sure you get your data in your systems and that it's accurate and things are out of spreadsheets, that your processes are streamlined, that you're getting as much data in the system as possible. Then you need to build a data warehouse, which is this last slides here, which is where it's going to, sorry, I realized that these are, I just started talking, I stopped looking at the slides. So data cleanup is that one I just talked about. Here's the changing your major systems, and then data warehousing is where you're standardizing the data across all those systems. So you have to do all of these steps for this to be successful. So what I really want to caution you is to meet a vendor at a conference who tells you they can do all this, and you jump in and you start implementing that system without going through these steps, because you're going to end up spending a lot of money and be frustrated with not good data coming out of it. We've all heard bad, you know, whatever data comes in, data comes out. So bad data in, bad data out. So it is, I think, the most in-depth and time consuming, but I really think that these tools are going to take senior living to the next level, and I'm super excited about them. Let's see if I missed anything. So yeah, these are just some of the questions I just talked about. You know, also these private data analytics tools, they can also be used for the LLM types of things you want to do as well. So once you've built this private AI tool, this is where you can then add, you know, use the LLM chat tools specific to your company data as well. So the other thing I want to say is I would not recommend trying to build this yourself. I have worked with a couple clients that are pretty big. They have, you know, 30 plus communities, and I've seen them try to build this stuff by hiring their own IT people. It's very complicated. You need to have developers who understand it. The licensing aspect is complicated. And I personally, and I've seen them spend a lot of money and a lot of time and not be very successful with this. So I personally would outsource this to a company that has developers on staff, has project managers on staff, has the resources to house this data for you, and they're experts in it. And we don't do this. This is not anything we do, but we have some reliable vendors we could recommend. But that would be something else I would say about this.
And I was just going to ask Amber, as we go through this, you're right. As a former provider, yes, I mean, I would love this where I could just query so I know when most of my falls happen. And so I know when my medication errors happen, this, that, or the other, or be able to find a shift report at my fingertips so that I didn't have to go and bother anybody while they're working. This is great. So this is something that you're saying that has to be built specifically for you. There's no in the box type scenario for you to just put this in and it work. This is something that has to be built because it has to be able to talk to all of your systems. Just want to be clear, that's what you're saying.
That is correct. However, I will say some of the tools out there already that I mentioned earlier, like I think we just did a podcast with Seniorlytics. There's some vendors out there that are senior living specific that are already hooked into the major systems that are at their dashboard tools, but they're building some of this into their tools. So okay. I think they're not as advanced as doing a private one, But I think that's the direction they're going to go, because why would you use a static dashboard when you can do this? So, I mean, there are at least, the 4 systems I just mentioned that I know of, and I'm sure there's more that I don't even know about that are senior living specific that already have a PCC connection. They already have a Sage connection.
Okay.
And that would get you a little bit further ahead than starting completely from scratch.
Okay, that's good to know. I just didn't, want anybody on the call to think, oh, I can go buy this and implement this. No, it's a little bit more, it's more than
Yeah,
that.
this is definitely the most in-depth, time-consuming, but I think also at the end of the day, the most valuable, honestly.
I would
Especially when we
completely
combine it
agree.
with the RPA, which I'm going to talk about next.
Thank you.
Yeah. Any other comments or questions on this? Anybody wants to add in the chat? Anybody excited about this? A little scared. Okay. It's always hard to do these webinars remotely. Okay, so the last pillar is RPA, which you guys have heard me talk about a couple of times already on this webinar. So RPA is robotic process automation, and this I think is combined with the previous pillar that I just talked about. I think this is going to be very powerful. So RPA is basically taking processes and automating them through AI. So an example could be, a bot that could read a PDF from a hospital admission and data enter it for you into the multiple systems that you need to put your residents in. It's basically just automating a lot of work processes issues. So, I think this is still pretty new, but just imagine, if you could, like the previous pillar I talked about is getting the data out. We're still stuck with the issue of getting the data in. And that has been an issue ever since we started implementing medical record systems, back in the 2000s. And when we went to medical records, I think that we've never really completely captured or underestimated the amount of time it takes to get data into these systems now that everything's electronic. So yes, it takes time to handwrite or to things too, or whatever, back on paper, but we now have the ability to get that data out. But we got to make sure it's in and it's accurate. I've been to more than 80 communities, and a lot of people are still budgeting in spreadsheets. I've seen a lot of paper documentation is still happening. People still have paper charts. So when you can add this RPA and you can automate the processes to get your data in and then be able to get it out, I think this is where we're going to definitely start to see a big impact. Again, this is something you need to outsource. And I've been told the names of a couple of vendors out there that are healthcare specific that are starting to get into this. So definitely, find one of those. But again, you got to be careful. You don't want to go out and just start using this everywhere. It's something you have to understand the use case. You have to understand exactly what the benefits are. I've also heard of some of these RPA tools being able to use for a data migration. So if you're changing medical record system, to use these RPA tools for the data entry piece. I personally would caution against that, because I've talked to some of the vendors who claim to do that, and they don't review the data at all or clean it up. And again, it's like a bad data out, bad data in type thing. So if you're changing medical record systems, you're usually taking a lot of information that you don't want to transition, like diagnosis codes, for example. So I still think there has to be a human element in that to review the data and clean it up and make it accurate. So something to think about. So, if this is something you're thinking about with RPA, what's time consuming, what can be automated, paper-based manual things. I also think that a lot of the senior living vendors have missed the mark a little bit in serving the industry well by focusing on just what their system can do. So they're missing a bigger opportunity to say, how can we integrate across multiple systems and multiple processes to make workflow processes easier for their clients, which is senior living communities. So let's just take the admissions process. That starts usually a lot of times, sometimes at the hospital, sometimes at the CRM, sometimes on a paper application or a PDF or whatever. How are we taking all of that and translating it all the way through to the move-in? Because that involves a lot of different departments, a lot of different systems. There's a lot of emails, the whole admissions email that gets, sent out to everybody. It involves a lot of different teams. So how do we look at a process and automate that? And I don't think most of the vendors are willing to think about it from that perspective. They're just thinking about their little piece that they can solve. And so this is where RPA could help tie some of those things together as well and optimize an entire process instead of just a system. Any comments, feedback, questions on that in the chat? Okay. So that covers the 5 pillars. We got about 20 minutes left. So that was kind of the bulk of the content. So, I will, if you guys do have any questions about that or feedback, if anybody's using any of these tools, I'd love to hear about that as well and how you're using them and how successful they've been. Otherwise we can kind of do that at the end and I'll go through the rest of the presentation. So some other things that we're going to cover. So you might have heard automation, workflow, AI agent. This is just a nice little chart that talks about the difference between those. So automation is not AI. And there's AI workflow, which would be sort of like using an LLM. And then there's an AI agent, which is more autonomous, sort of like the RPA tools that I was just talking about. So there are automation, not all automation is AI. So one of the things people like have asked us about is robotics. And we decided robotics are not AI. We're actually going to be writing an entirely different guidebook on robotics and actually falls management just exclusively for our clients again, because it is a different topic. Some robots are using AI, but a robot is not an AI tool by nature. So, I think that sometimes we kind of think everything is AI and it's not necessarily. Okay, so this is from our white paper we wrote. So you guys can go ahead and download that. Again, there's a QR code in here. But these are all the vendors that we talked to. So 18 different vendors. So I do see Yardi on here, and I know PCC is on here. Some of the resident engagement apps are on here. Some nurse call vendors, falls management. Yeah, so Profix is a analytics tool, LifeLoop I see. So we just basically asked them what they're seeing, what they plan to do. And again, we did do this maybe like a year and a half ago or so. So we should do a 2.0 version, but what do they see are the advantages, benefits to AI? So a lot of things we talked about: operational efficiency, improving resident care, transforming the experience, reducing human oversight, reducing staff burnout, helping with the workforce is the other buzzword we hear, and culture change. So speaking of culture change, I mean, I think that's going to be a hard thing with AI is just getting people used to using it and even like kind of understanding what it is. And I think it's still very legitimate to have like some fear around this and fear of change. Some of the pitfalls they see is just over reliance, deploying it without proper planning. So that's why exactly why we build all these tools and resources is to try to prevent that from happening. And then the data quality issues, which that you can run into that with everything I talked about with the private AI tools. So it's just, it's important to be strategic with this. And again, like with our clients, it's taking the roadmap, looking at the tech pyramid, and deciding where is AI appropriate to use and are you ready for it? So takeaways from those thought leaders is it's going to be transformative. I think everything I just talked about, the 5 AI tools or pillars is transformative. Governance and oversight is required. And we're not trying to necessarily replace jobs. We're trying to enhance workflow and let people spend time on other things and make their experience better with the tools they're using. Okay, last section is governance and ethical considerations. So the very first AI presentation I did for the Mennonite Health Assembly was with Ryan Galea. Sorry, I forgot his last name. Ryan Galea or Galea, I don't know how you say it, from Icon, the CEO. And he's an attorney, which I did not know because someone asked a legal question. And he was like, well, actually, I'm an attorney. So there has not been, from what he said, there has not been a lot of legal challenges, regulations, oversight on AI yet. So that is something that we're all going to figure out together. So I will just say it's a very unknown area at this time when it comes to regulation and precedents for legal cases. So, okay, so this is what I just mentioned earlier. I forgot there was a slide about it, but this is the tech pyramid. So this is, again, is how to be successful with AI. So this is the pyramid we use for our roadmap. So we have to build up our infrastructure and operations. So an example of that is if you're trying to deploy like a falls management tool that has AI, but you don't have Wi-Fi, it's going to be an issue. We've had clients try to do that and spend money on systems that don't work because of no Wi-Fi. Optimizing your business systems, which we talked about that already in the private AI section. ensuring your technology culture is ready to embrace new tools and technology and change the way they think about doing things. And then at the top, we have the innovation. So that's where the AI would fall in. So we want to work through all of these layers of the pyramid to be successful with, and it's not just AI, it's anything you're deploying that's new. So it could, this really is used for anything that's innovative. We talked about this already a little bit. So, anything you put in an AI program that's public facing will be remembered and added. Well, internal too. So if it's an internal tool, will be added to the overall knowledge. But again, if it's a public tool, you just need to be aware of that. Part of our AI guidebook is working with clients to establish an AI steering committee if they would like to do that. And we're going to have sample agendas and how to build that up, and something we'll be helping clients with if they're interested. So, just like we recommend a technology steering committee for just managing the roadmap and the pyramid, because AI is new and there's a lot of options and things out there, it might be something to think about to have like a mini committee that could be part of your technology steering committee or a separate committee to help guide and make those decisions. Especially when AI may not be considered under IT or technology, because maybe you're thinking about it just for false management. And maybe you're like, oh, this is a clinical decision. It's not an IT decision. Well, as we know, almost everything is IT related in some way. So, how do we make sure, again, going back to the pyramid, that we are, making sure we're ready for that to be successful and involving all the right stakeholders. So that's what the AI committee could do. It could bring different stakeholders together. And just with, again, this applies to really any system you're going to be changing or making a decision on or implementing. But again, specific to AI, make sure you understand the use case. Why are you doing it? Like going back to the beginning of the presentation, you don't want to get AI just to get AI because, a board member brought it up or the CEO brought it up or you heard about it somewhere. We want to make sure we understand why we're doing it. What's the use case? How is it specifically going to benefit us? And again, you don't want to just go with the first vendor you meet or you've heard of, or somebody else is using. You want to assess each different vendor and make sure that it makes sense and they're going to meet all of your needs. Which again, you want to do that with anybody, but especially with AI being so new and so not well understood, I think that there could be vendors out there who are just taking advantage of that lack of knowledge to try to sell their system to you without you, fully understanding what it's going to do for you and it's going to work for you. Build your AI implementation roadmap that can go through the steering committee, training and education, and then of course monitor and optimize it as well. So again, it applies to really any system, but especially AI with it just being such a new area. So some of the stuff we talked about already, the HIPAA side, the data security side, transparency, like we just talked about earlier, it's important to ask the vendors you use how they're rolling out AI. You want to do the same thing with your stakeholders. Make sure you're transparent about AI, and then you obtain consent if you're going to start gathering data. And for the resident engagement systems that are doing using AI for resident data in their systems, I wonder if they have come up with a formal process to get that consent before rolling it out. Okay, so key takeaways. I said this already. Not everybody's using it. Most people aren't using it. And if they are, they're not using it like in all of the ways that I mentioned. So don't feel like you're behind. Again, I said this earlier too, AI is not always accurate, but neither are people. I think especially like in the hospitals, they're saying like there's some resistance pushback to AI because they're saying, well, it's not always correct, but doctors are not either. So, nothing's ever 100% accurate. And that's actually the end of the presentation. So there's some of the QR codes again in here, and I'm going to stop sharing and just see if there's any other questions, thoughts. I'd love to get feedback. Was this helpful, useful? Did you learn something? Any thoughts anybody wants to share? We're always trying to improve the presentations we're doing with the feedback we get.
Amber, before the chat comes in, one thing, definitely I think that needs to be addressed here is the regulation that is around the data. For those of us that are in the field, as we know, regulators come in and they look at our data and they, make sure we're doing everything according to regulation. So this data, I would assume that is all put together, they could query it any way that they see fit. So I think back to your processes, when we're looking at the stakeholders, and your regulator is definitely a stakeholder, is also a consideration of the data that you have and the data that you're mapping, what is going to be available to someone, to a stakeholder of that level. And
It's a great question. It
and so
hasn't
I
come up before, actually.
well provider, previous provider, and it always is kind of a tough walk when they're looking through a record and looking for something that they're looking for that you don't know that they're looking for.
Mhm.
And so you don't want to overload with every single thing, because there are some things that you are looking at pre-planning that may come through your data, and a surveyor may look at that and say, there's a problem here and you're not addressing it. You haven't talked to the doctor, and you might find your place in a citation when really you're being just very, very proactive about it. So I think one thing to consider, and especially when using the robotics for transcription and all of that information, is how is that going to look on the back end to regulator access?
Yeah.
And I think that's going to be really important to understand.
Yeah, absolutely. I mean, is it discoverable? I think is what you're saying. Can they just go in and request access to that if they know you have it, So I don't know the answer to that. I don't know if they've even thought of that themselves yet either. The
Well,
regulation.
and yeah, and I think here in Missouri, especially if the surveyors aren't up to speed with that type of data and
Mhm.
knowledge and AI, and they're not.
Yeah.
So it would be, this is something that's going to look entirely different to them. And it's going to be more data than they've ever seen, because we're trying to be proactive. We're trying to, monitor our falls and monitor weight loss and monitor anything that we come up with.
Mhm.
Being involved in activities, especially that resident engagement. And it may flag that you're trying to come up with something for someone, and a surveyor might look at that and say, oh, so you've got someone that's not participating in activities. So,
Yeah.
you know,
I know we've got Sandra on the call and she's an attorney. I don't know if Sandra has any thoughts on this. I'd be curious. Not to,
Sandra, if you plug
not to
in,
call you
that'd
out.
be great. But as people start using it, I definitely think some case studies, just from that aspect of from a regulator view of what really were your outcomes that you saw with that, and how can others prepare for that stakeholder with information, because that's where it's really difficult, because you're putting this in the resident's file as their health file, and a regulator has access to the entire health file. So
Yeah.
how are we managing our data that it's a positive experience, instead of it flagging that there's something going on and you quote unquote haven't done anything, whereas before times no one even would have ever saw that because we couldn't have put that together. So I don't know. I think that's going to be a valid question as we all continue to go down this road. And I think in 10 years, we'll all be here and be using
Mhm.
it. But, really just some real good thought consideration on what that looks like.
Yeah.
I think it's
And
going to be important.
I do see a question in the Q&A as well. Glad to know how public ChatGPT is, and kind of scary to know how many people use it. How well known is this? So I'm assuming you mean that it's public. Yeah, I think a lot of people don't realize it. I mean, I think people put stuff in there that they don't, and they don't know that it's something that is public information. So yeah, I think tell all your friends, because people use it all the time for just day-to-day questions. I mean, my kids use it for their homework questions sometimes. So yeah, I don't know if people know that.
Yeah, I think people need to know that. Okay, well, okay. We have another question.
Oh, where is it?
It's in
Oh,
the chat.
okay. AI is impacting resident, then it should be care plan policies to be written to support the action of the facility. Yeah, absolutely. Yeah, I mean, you guys know we need a policy for everything. Sorry, Sandra. I didn't mean to put you on the spot either. But yeah, definitely policies. Also in our client only guidebook, we have sample policies that we're giving clients for acceptable use for ChatGPT and things like that. I'm sure you could use ChatGPT to write your own policy though. But yeah, and then it's again educating people to make sure. I mean, going back to the note takers, like as a basic example, like is everybody even aware of not saying HIPAA related information, PHI on those note takers, that's not protected. Yeah, and then Sandra, your comment. I mean, if you have anything to share, I mean, that would be really interesting because it is something a lot of, if you do look into it, if you want to let me know what you find out, because I mean, we all know we still have surveyors coming in and asking for records to be printed. Like, I don't know how quickly they're going to adopt some of this, but it probably will come, like if they know they have access to all this data, why would they not ask for it? So yeah, that's a great thing and if we find out, we'll start including it in our presentations going forward.
Well, and I think that's a great segue as we wrap up this session to thank Amber, number one, for your insight on such a hot topic and needed direction as we're all going to be adopting and moving forward in the future. But just like what we talked about with, Sandra bringing in more information, you will be able to see Amber live to do a deep dive into this if you would like to. Um, once we compile more information, the presentation gets better. She will be live September 16th at John Knox Village for another free learning event from LeadingAge Missouri. I've put the link in the chat. You can also find it.
I'm going to repost it because you accidentally did it just to the panelists. Oops, nope, that's not the right one.
I did.
Yeah, sorry, I did copy paste. If you want to redo it and do it to everyone, because I think it just went to hosts and
Oh,
panelists.
I'm sorry. I apologize.
I've done
See,
that by accident too.
But please feel free. Also, want to let you know that we're going to be sending out an evaluation after this is done for all my Missouri admins that are on here. I would request that you fill out that evaluation so we can get your CEUs processed, and we'll be sending certificates out pretty soon. And I just once again want to thank Amanda and Amber for putting this together for LeadingAge and its members and your members as well, because we're going to keep teaching it because it's coming. So thank you again. We appreciate it.
Yeah, thank you.
Thanks, everybody. Have a great day.